Before we had this facility, I used to just open my private practice 4 times a year, and this went on for several years. The operation was getting too big, too complicated, and we needed to do something different. And that's how the Clarkston Community Health Center was born.
Clarkston has over 60 different countries of origin represented here, and that's in large part because Clarkston is one of a refugee resettlement area in the United States. It's oftentimes called America's most diverse square mile, or the Ellis Island of the South.
Unfortunately for the migrants and refugees and immigrants, by the time they come to us, their condition is so advanced. We see patients walk in with blood pressures of 250 over 140, 150. We see blood sugars of 600. I mean, that's not at all unusual. A1Cs of 14, 15, 16, which would be very, very rare in a private practice.
COVID and the pandemic really affected our community in Clarkston tremendously. A lot of community members are essential workers, and so they were some of the first individuals impacted and stricken with the virus. And especially in the Clarkston community, a lot of individuals live in multi-generational households, which made it very difficult to be able to self-isolate. We were in constant communication with our volunteer network and our university partners, figuring out what does testing look like, what does the future look like. And so we were able to partner with the Georgia Department of Health and DeKalb Board of Health to be one of the first Sunday PCR test sites. So our team arrived at around 8 o'clock in the morning. We set up. We put on full PPE and stood out in the hot Georgia sun last year from May until September. Some of the days were very long and hot and tiring, but they were worth it. We had volunteer nursing students, volunteer pre-med students, and a lot of nurses, doctors, nurse practitioners, and healthcare professionals coming out and volunteering their Sundays to be able to provide that test.
When we started doing PCR testing in Clarkston, at one point we were seeing 25% positivity. So we knew that our area was impacted gravely. Well, why? Because first of all, a lot of our patients are frontline workers. They drive taxis and Ubers and buses. They do custodial work. They work in farms. But when these patients come out of the hospitals, if they do, we know the mortality is very high. The young ones coming out of the ICUs, the 20 and 30-year-olds, 40-year-olds, it's sad to see what this COVID has done to them. They are mentally foggy, they are physically very weak. They may not have jobs again. Their cognitive functions are compromised. And so even if they go back to work, will they be going back to what they used to be doing? When you have several numbers of individuals in a community that become suddenly compromised, what happens economically to that county or that district or to that state? And that trickles down to what happens economically to our nation.
The more that I volunteer here and work here and help the community, and I realize that we're more alike than we are different. Don't underestimate the value of community, not only the community that you were born into, but the community in which you live, work, pray, communicate with here in the United States as a refugee, immigrant, or migrant is very powerful.
It is important that we continue to not forget that we still have an obligation to protect these individuals. And so what other elements do we have right now? We had the vaccine, we had masks, we had hand sanitizers, we said about public places and social distancing. Well, what else do we have? The only other thing we have right now is testing, really. And regular testing, being vigilant about testing. I would beg our legislators to please continue to push for the vaccines, push for the masks, push for social distancing, and please continue to fund testing.